Hello, hello, hello. I greet you again. I believe that you are doing fine. Alright, so I come again to present Rubrics 2 of Physiotherapy 4th year. My name is Kenneth Motutwa. Okay, so I begin my presentation in ortho. Alright, so musculoskeletal conditions in physiotherapy. I'm presenting on the topic fracture, classifications of fracture. Alright, so in physiotherapy, fractures are classified based on various factors. Alright, so without going further, allow me to actually define what a fracture is. As you can see on the screen, is that a fracture is a break in the continuity of the bone, of a bone. Alright, so there are various causes of fracture, such as the intrinsic causes and also the extrinsic causes. Now on these ones I'm not going to explain right now, but I'll explain further as I'll be explaining on the classifications of fracture. Okay, so one of the classification of fracture is explained on the based on the stability. Okay, the stability, what do I mean? Okay, there is a stable fracture and there is also unstable fracture. So when a fracture, okay, the bone alignments, the fragments of a fracture, they are aligned, okay, they are still intact, they have not been displaced. Okay, so this one we call it a stable fracture. Examples, of course, there is a hairline crack, there is a green stick fracture, which is found also in children. I think I had this one before when I was very young. All right, so the other one is called unstable fracture. So what do I mean when I say unstable fracture? It's when now the bone fragment are displaced or likely to be displaced. Maybe they have moved like this, so they are not in alignment. So this one we call it unstable. One of example is comminuted or spiral fracture. I'm going to explain what comminuted is and spiral fracture as we go down. All right. Based on bone involvement, number 2, based on bone involvement, there is a complete fracture and there is also incomplete fracture. So when I say complete fracture, meaning the break goes entirely throughout the bone. Okay, one of them in which there is transverse fracture, oblique fracture, and also spiral fracture. Alright, so the other one instead is called incomplete fracture. There is just a partial break, okay, which is found also in the children, which is green stick, like I explained earlier. Okay, fine. So now, as we continue on the third one, we find the special one, which is called based on the skin integrity. So if a bone, okay, may remain inside the skin without breaking out the skin, this one we call it a closed fracture or a simple fracture. Okay, so the skin is intact. But the open fracture, it is called also a compound fracture, which means the bone pierces the skin. Okay, and this one has higher risk of what? Infections. Based on the mechanism, like I said, on the causes, it can be traumatic fracture or pathological fracture or stress fracture. So traumatic fracture, this is due to the direct trauma or fall or an accident which had happened. Okay, then on the pathological fracture, this one can happen maybe due to some osteoarthritis. Maybe it can happen through what? Osteoporosis, or maybe the cancer, or osteomyelitis, or any other, maybe disease that can cause what? The bone fragment, okay, to break down. Okay, so that is what? Pathological fracture. Okay, the stress fracture, it is just happens maybe overuse or repetitive strain. This one usually happens on the head of a femur, especially to the athletes. Okay, so now based on the fracture pattern, this one allow me to explain it from here only. Okay, from the picture which will be displaying on the screen. Okay, so now types of based on what the fragments. There is a normal one which you can see here to say it is not tempered. There is a transverse one. Okay, as you can see, that fracture fragment, they are really, in the transverse shape. There's the oblique one where you can see the forces that have caused the fracture to be in the oblique position. Also the spiral one, or there's some shear force, okay, some kind of force which are twisting, okay, comminuted. There is a small fragment of fractures, okay, the segmental one, okay, more than two, okay, and the avulsed fracture,